Ladies and gentlemen, could I say mostly ladies, it's a pleasure to be here. As I was standing in the foyer waiting to come in, I thought to myself the criteria for being here is that you had to be A, under 30, B, have a sparkling personality, and C, be female. Because I think that sums up most of the people in the room, doesn't it? Yes, you're all nodding. But I'm glad to say that there are some males here this morning to balance things out, but not that many. And I think that's an indication where this process is going. We've had a very welcome increase in the number of female staff within all aspects of the health service. They're taking over the world, and the shock is, of course, it's being done on merit. So I'm no doubt there will be some very talented people speaking here this morning, both male and female. I am probably the worst person in Northern Ireland to be doing this morning. I have no discernible musical talent whatsoever. 25 years ago, a cheque for £30 came through the post to me. And it said, "Dear Mr. Wells, thank you for the lovely solo you sung in the church service last Sunday night. Please find enclosed a donation of £30. I sent it back and I said, "Sir, if I'd sung in your church, the last thing you'd have thought of doing is sending me a cheque for £30. But try Gordon Wells down the road." Gordon was a leading soloist. So I have no discernible talent. I could just about strike up a national anthem on the right note on a good day. I know I haven't got it, and I wouldn't dare inflict it on anyone else. But I have a very talented musical wife, and I have a very talented musical daughter. And indeed, she is a music teacher in North Island. And we've just, about 15 months ago, we had our first grandchild, Josiah, who I think is a mixture of Brad Pitt and Albert Einstein. And I'm entirely and utterly biased in that respect. But she did tell me that while she was doing music classes at school, the baby, before it was born, was dancing inside her tummy to the beat. So she thought that was one of the most wonderful experiences in her life. And we're very conscious that Mrs. Holmes is about to be rushed off at a fast ambulance today, so we're watching out. So I'm sure she's had the same experience. It is an absolute pleasure to be here, but somewhat worrying when I saw that there was a dedicated Twitter site to this conference. I had the experience in Le Mans House Hotel a few years ago of speaking, and the guests and the delegates were asked to make comment on the quality of the speaker on Twitter live as I spoke. And of course they could do it anonymously. And so whilst I was speaking, people were tweeting, "What a load of rubbish. Boring speaker. Will he not sit down?" And of course there was a titter going around the room, as well as people saying, "Oh, very positive contribution." Those were the paid civil servants, of course, on the screen behind me. So I hope that doesn't happen this morning, because it is quite off-putting, particularly if it's true. The other thing I'd say is that I am only in post, as I say, I'm actually exactly a month today. And I'm still getting very used to it, as are my staff. I was going to dinner tonight in the City Hotel in Londonderry. I think I'm going to meet some of you. I think it looks like a very interesting evening all round. But I was going to another dinner in Le Mans the other night, and my private secretary said to me, "You're going to that dinner, Minister?" I said, "I am." She said, "Do you want to take Mrs. Poots as well?" And I said, "Well, I'd like to take Mrs. Poots, but I don't think Mr. Poots would be that amused." But if you're telling me that one of the benefits of being minister is that you're entitled to take other MLA's wives out for dinner, well, that strikes me as a good deal. So I think even they're finding it, like myself, a wee bit difficult to come to the terms that there's a new reign of terror has just started. So do forgive me, as I say, I'm only starting this particular process, but I am delighted to be here for the launch of the results of the Music in Mind research programme. I understand that this research programme is the largest study to date involving music therapy and children and adolescent mental health services, or CAMS for short. And I'd particularly like to thank the 250 children and young people and their families who participated in this research. And already this has been mentioned, we could not have done it without your support. Indeed, remember, election polls are done on the basis of 1,000 people for all of the United Kingdom. So the fact that you've encouraged 250 people to give this valuable information is an accolade to all concerned. As you know, we have an AHP strategy, and that was launched. We launched the Northern Ireland Allied Health Professional Strategy called Improving Health and Wellbeing Through Positive Partnerships in April 2012. And it recognised music therapy as an allied health profession for the first time, and I know that was welcomed by everybody in this field. The Allied Health Professionals Strategy sets out a high-level roadmap for the development of AHP workforce and to support the commissioning and delivery of AHP practices to enhance health and social well-being amongst the population in Northern Ireland. Key to the success in that strategy is the positive partnerships with service users, carers, health professionals, commissioners, education and other agencies. And I suspect that all of those groups are represented here this morning at Riddle Hall. The lead health officer from the department is Hazel Winning, and at Hazel you will note she's here somewhere now because she's got this very distinctive, green dress on. Hazel's our lead, and she's taking forward recommendations for that strategy through what's known as the Regional Implementation Board. AHP professionals, including musical therapists, play key roles and add critical value across the full spectrum of primary and secondary prevention, diagnosis, treatment and care. Our strategy recognises that utilising research, knowledge, I hope there's no messages gone up, no, nothing yet, research, knowledge and evidence to change and improve ways of working for the benefit of service users, and of course that is essential. Within health services in Northern Ireland, we have seen music therapy being used in special schools and working with children with learning and physical disabilities. I'll be very interested, and I mean very interested, to hear the outcome of this research in terms of how it may benefit our children and young people with mental health problems. A child's journey into adolescence is starting earlier and finishing later than in previous generations. Consequently, young people are now experiencing many of the personal and social pressures that adolescence brings at a much younger age. Certainly, my children, well, they're children, one's 29, one's 26 and one's 23, so I suppose you could hardly call them children anymore. But certainly my children were exposed to things as teenagers which I could never have experienced. And childhood is becoming shorter and adolescence is becoming much longer. And indeed, the sort of bedrock of society, which used to be the nuclear family, mother, father, 2.4 children living happily ever after, unfortunately that building block of society is breaking down rapidly with obvious mental health problems. And many of the support systems that previous generations relied upon and took for granted are not available to young people today. Family structures have changed and often quality family time has diminished, and that's the pot calling the kettle black, I can tell you, in my particular role. Much of which has been done to develop CAMHS services in the last few years. We now have 4 community-based CAMHS teams across Northern Ireland and a regional inpatient unit for children and adolescents. But much remains to be done, and I'm sure the theme that will arise this morning is concerned about the level of funding for this particular important role. They often say that if the major hospitals, the A&Es, are Cinderella, are the ugly sisters, then social care provision is Cinderella and mental health is Cinderella's mouse. And there's absolutely no doubt that when you compare mental health provision and funding in Northern Ireland with the rest of the UK and other Western societies, it is grossly underfunded in this province. The evidence will indicate between 19 and 24%. And that has been a real difficulty that I know that many people in this room have been lobbying both the Health Committee and the Minister about. The reason for that is obvious, that when you have a unified health and social care system, including mental health provision, it is inevitable in the battle for resources that the big A&Es, the cancer unit, the heart surgery, the pharmacy budget will always shout loudest and will always have the strongest voice in the demand for finite resources. And that has left us in a position where it's quite clear that many people working in this room are under-resourced, and I'm the first to accept that. And I'm hoping that the new legislation that's coming through very soon, the mental health incapacity bill, which we expect to get through by the end of this Assembly session, will address some of those issues, because it is an issue of real concern to me and is causing problems in terms of providing adequate services for people in this situation. Future improvements in CAMHS across the region will include an increased focus on early intervention, which of course is very much in line with transforming your care, better multidisciplinary working, better cooperation with the community and voluntary education and youth justice sectors. This will ensure that our children and young people have access to the full range of support that they need no matter where they live in Northern Ireland. And I'm certainly one that subscribes that the world doesn't end in Glengormley or Carryduff. We need to make certain that we have even provision throughout the 5 trust areas. As part of the CAMS reforms, we are seeking to ensure that our children and young people have access to the appropriate range of evidence-based intervention. Some of the NICE guidelines on mental illness in children and young people already refer to this. Already referred to the use of art and musical therapies in treating many of our young people. It will be interesting to hear if the research indicates that music therapy has a demonstrable impact on young people with mental health problems. I've already been lobbied by several people in the room who would like to meet me on this subject when you have a chance to digest the report. And yes, the door's open in that particular respect. I would be very keen if you could, and not all of you, but a selective group could come and see me about that. But that's predicated, of course, there's no nasty messages on Twitter on the screen. I'm delighted to see Northern Ireland at the forefront of such gold standard evidence-based research programmes such as this one, and would seek to find innovative and creative responses to meet mental health needs of our children and young people. If this research finds that music therapy is an effective treatment for children and young people with mental health problems, then this is an area for consideration for my department and, of course, the Health and Social Care Board, who are the commissioners, in the overall reform of the CAMS service provision. Could I thank the Northern Ireland Music Therapy Trust, Queen's University, Belfast and the Belfast Health and Social Care Board for leading the way in this important piece of research, and look forward to hearing about your findings. Could I also say it's been a privilege to meet Professor Swallow. I hope you are a professor, or a doctor, I'm not quite certain, but I'm sure something very important. But to meet someone who took the lead so long ago, at a time when this issue was not fashionable, and where perhaps there may have been sceptics as to the value of music therapy. Well, we're well past that, and I'm hoping that this research will be a fitting tribute to the work of Dr. Swallow. And I really genuinely look forward, as do, I'm sure my daughter as well, to the outcome of this research, to the conclusions that you come to and arrive at. And well done to all concerned, and I really hope this will be a milestone in this very important therapy. Thank you.